record, and let's go on for week 2. So you've gone through week 1. I know it's a whirlwind, and it's confusing. Many students' classes were changed and switched, and so I'm a little bit lenient with week 1, looking at discussion questions, etc. So you guys will be just good. This week, we're going to be going over infants, toddlers, and preschoolers. And if you can imagine how much a child grows from that 6 or 7 pound infant up to a 5-year-old, the changes are immense. You've gone from not being able to lift up your head to be going into kindergarten. So there's so many things. And what do you need to know growth and development? So I'm going to try to teach you so that you're going to remember. I do have some redundancies in it that I'll keep going over. It's because those are some concepts that you need to know. I was asked in the earlier class, how do you study for this class? Well, I would hope if you have that chance, and I know you're busy and so much is going on, to look at the interactive PowerPoint before coming to class. It's going to give you stuff that I'm going to go over. And in my PowerPoint, I do describe all those things that you're going to see in that PowerPoint. So you've looked at it once, I teach you a PowerPoint, and then I do a Kahoot. That's 3 times repetition. You're going over things. And I think by doing it that way, that it's going to stick, because it has been shown that repetition helps you remember. Then you go back, and how do you study for exams? Go back and look at the PowerPoints, look at the Kahoots, and we do a study guide in a PowerPoint form. And every one of these professors in pediatrics right now will be doing a review. Look at one or look at all of them, whatever works for you. Remember, we all teach a little differently. So you're going to get different views on the way that people are going to describe what those PowerPoints are saying for the study guide. So I'll make sure that you get all that information you need. I try to keep you organized in that manner, keeping it on one announcement so that you're able to find things you need quickly, not waste any time, because you don't need any time wasted on how busy y'all are. So let's do our PowerPoint. Let's see that we get it done. Let me check one thing, because I had some issues earlier, but I think we fixed it. Yes, I did. It was doing this transition moving ahead by itself, and it shouldn't do that. So from the beginning. So infants, toddlers, preschoolers, chapters 31, 32, 33. So much stuff goes on. So let's talk about, an infant. They're born, they're 6 pounds, and they can't even lift up their head. So we know that growth and development goes quickly during infancy. The central nervous system is the fastest to grow. The central nervous system innervates those nerves, which innervate those muscles for all those movement, gross and fine motor development. So it is the quickest. We know that if this child is getting proper nutrition, we know their growth and development should be where it should be. Their cognition, their growth should all be where it should be. So initially, at first, children lose about 10% of their body weight. We know that. They're soaking in amniotic fluid. And we know that if you ever looked at an infant at birth, and then they send it to the nursery to be weighed and to assessed, and you bring that infant back, they look different, because those puffy eyes and whatnot are gone, because they probably urinated a couple times and they got rid of that little extra fluid. So they're going to be gaining 5 to 7 ounces of weight gain after that first week of losing some weight. Then by 6 months, they're going to double. By 1 year, they're going to triple, and their height is going to be growing. Now, you can watch an infant. They'll get pudgy, and then they'll get taller. And it's like this stair step. And I think in every age of childhood development, you're going to see that. They'll get pudgy, then they grow tall. They get a little pudgier, and they grow tall. It's just part of what children do. Now, as children are getting older, you're going to see that their vital signs, the numbers are going to come down. What do I mean? Well, we introduced that the heart rate for an infant is 140 to 160, right? That's normal at rest. It could go down a little lower to 100, 120 on deep sleep, but overall, let's say 140 to 160. As they get older, these numbers will come down, and the heart rate, the respiratory rate, the blood pressure is going to get higher because these systems are more efficient. The heart beats better, the lungs, breathe better, the exchange of oxygen and carbon dioxide is better. So you'll see it slow down. It doesn't have to work as fast. Now, when a baby is born, they are given mom's immune system and they're given their blood. So whatever your hemoglobin hematocrit is, that baby's going to get it. But infants do not start making their own red blood cells till maybe about 6 months of age, which means what? Well, red blood cells do die like they normally do. So your hemoglobin and hematocrit are going to drop. So there's this physiologic anemia. Your numbers could be 8 and 24, 9 and 27, normal for a 6-month-old because they are not making their cells yet. That's why we give iron. If we're going to be given iron to these children, so that at least they've got that extra iron in their body for the red blood cells that they do have. Their head, we know they grow big. We know they're born big, and we know that, it's rapid during the first 6 months of life. The posterior fontanelle, right here in the back, it closes by 6 to 8 weeks. But the anterior one, that soft spot that we all know about, it's not going to close to about 14 months old. Now, we know these weeks and months. Why? Well, if it closes too quick or too late, something's going on. And we need to investigate the reason why. If it's still open and the child is 2 years old, why? Is it hydrocephalus? Is it a tumor? What's going on? It shouldn't be always open by that age. Or if it closes too early, that brain is still growing, it's getting squeezed. So both ways we need to investigate. We know at birth they don't see that well, they don't see colors, and it gets better as they get older. And we also know that they're born and they're seeing out of each eye, but they don't work together yet. When you put your finger out, you're going to look, one eye is going to be a dominant eye. On an infant, it's not. So depth perception is really not where it should be yet. As I said, that nervous system is the quickest growing. The nervous system, it sparks nerves, which go to muscles. What does an infant do? They lift their head. They roll over front to back to front. They crawl, they creep, they walk. This is all part of the nervous system. So nutrition, nutrition, nutrition. They need it, really, especially during this first year of life, because it will help them do the development that they need to go. So the immune system is also going to get better because mom's system is going to be gone. That's why when if you looked in your book, you saw 2 pages of immunizations. There are so many immunizations we give infant. Like, why do we give so many at 2, 4, and 6 months? Well, the infant has no immune system. Mom's is going to go away, and then they're left with nothing. So we are giving them as much protection as quick as we can so that they can fight these diseases, which are extremely harmful to them. And with this, the body, given those immunization, can produce those antigens, which can fight these diseases. We know the GI tract has stuff, and there's all many things that can protect these infants, but immunizations given 2, 4, 6 months, 12, 15, 18 months, we're giving them quite quickly. Now at birth, what's the first thing we do with an infant after mom has the baby? We put them on a warmer. That's hot. Why? They have no ability to maintain their own temperature. They don't have all of that fat tissue, which protects them about heat getting out and getting them cold. And we don't want an infant to get cold. There's many things that can happen from that. We know at birth, again, they have that amniotic fluid that makes them puffy, and we're going to get rid of it. And that gets cold really quickly. So making sure that we keep infants warm is important. You don't have to overdress them in 16 different coats and hats and whatever, but we need to know that they cannot maintain their own temperature. Now, we know adults, 30 mLs per hour is the lowest mLs per hour that you can have as urinary output. If it's less than that, we know there's a problem. Well, infants are different. Just like we give meds, milligrams per kilogram, It is mLs per kilogram. So they should have 0.5 or half an ml per kilogram per hour. And if they don't have that, we know that the kidneys are not producing what they should have. And we know with all the body systems, they're not as mature as they can be. Now, I have another question about urinary output. How do you measure it on an infant? They pee in a diaper, right? So how do we measure that urinary output? Well, what we do is we're going to weigh the diapers. Let's say size 1 weighs 30 grams of weight. Put it on a little scale, it's 30 grams. You take a wet diaper off of a baby and it weighs 60 grams. It is 30 mLs of urine output. So the difference between the wet diaper and the dry diaper in weight equals mLs of urinary output. And we can measure it very, very easily. The GI system, we don't feed infants food until 6 months of age. The only time we give any food is some cereal to thicken the milk so that in case of reflux, etc., that we can hold the milk down so they get the nutrition. But that cereal is going to come right out in their stools because they can't tolerate food yet. It's not ready to do that. All they can tolerate is that, the breast milk or iron fortified formula. So fine motor development is F, fine fingers. Think of fine motor fingers. Gross motor, get up and go, go, go like Paw Patrol, is movement, any type of movement, okay? So normal, grasping objects, 2 to 3 months. When they can grasp it by themselves, they can transfer it about 7 months. They start a good pincer grasp at 10 months. Earlier than that, it's more of a crude. At 7 months, they still can do a crude, but they're not into just a finger and a thumb, okay? Then they go up to about 11 months, taking stuff out of a container, and then building a block of 2 is at 12 months. So there's different things we look for these children in development to see if they're progressing properly. So for you to examine and test yourself as you go on for exam day, this is exactly what I just said. Gross motor, get up and go, 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 movement. We know infants are born, they cannot have any neck control. And we're always saying, watch that neck, watch that head. And you're supporting the head and the neck because it just will flop around. There's no motor control there. So the first thing that we get control of is the head control. If they're not head control, or you pick them up with their arms like this baby to the right, the head back, and it's 6 or 7 months down the line, something's wrong. The first thing that they should be able to do, they can't do at that age. Again, find out why, early interventions. Rolling over, they should be able to go from belly to back at 5 months and back to belly at 6 months. So then I'll ask you a question. If you take an infant at 6 months old, put them on the couch because you have to go run, get yourself something to drink or the baby, its bottle, whatever. Should you put them on the couch alone by themselves? Oh, absolutely not. Because by 6 months, they can roll over and they can hurt themselves. So knowing growth and development can help you protect the infant and to teach your parents about protecting. By 8 months, they should be able to sit up unsupported, no toys, no blankets stuffed around them. They should be able to sit up by themselves. And by 10 months, they should be able to go from their back and they should be able to sit up. And these are normal. Now, it doesn't mean you have to wait till 8 months. There are children who sit up quicker. There are children who go from prone to sitting earlier. As long as they're moving forward in growth and development, we're doing good. So the most important thing that we can do for our children is nutrition, nutrition, nutrition. So for the first 6 months, it's either breast milk or iron fortified formula. We know why iron fortified, because we're not making red blood cells. These children can become anemic, right? So breastfeeding is for at least the first 6 months, and we're not going to add food until they become 6 months of age. At that time, we'll add 1 at a time, and it will go 4 to 7 days in between each change to make sure there's no allergic response to them. Breastfed, they should, 8-10 minutes each side should be good. Told you already, 10% of their body weight is lost in the first week, and then they start gaining weight really, really quickly. And one of the things that I've always heard with these breastfed infants is the parents goes, well, how do you know if they got enough? Well, as long as they're having 6 to 8 wet diapers a day, they're eating plenty of food, okay? As long as their fontanelle isn't sunken, they're not dehydrated, heart rate's good, 6 to 8 wet diapers, this baby is drinking plenty enough milk. And one of the things we give infants is vitamin D. And the reason for vitamin D, D works on muscles, works on joints. And what is an infant's first job? It's to start moving, right? So we need those muscles and those joints to work well. And that's why we give vitamin D. So what nutrition do we give that second 6 months? So we know we start adding it slowly, one at a time, 4 to 7 days in between. Well, it used to be, say, you start with rice cereal, but today it depends on your pediatrician. As long as it's one at a time and you wait that 4 to 7 days in between, that's okay. And then you add. Dental health. Well, babies do get teeth. And when they come up, they do need to be brushed because milk is carbohydrates, or juice. Juice is carbohydrates, and it can rot the teeth. So either toothbrush only or a washcloth, a wet washcloth, should be done before they go to bed or for after they eat, so that the sugar is off their teeth, so they don't have that happen. You can start with fluoride at 6 months. And one of the most important things is not to prop that bottle. It's harder when you have multiple births, twins, triplets. You're going to be propping them like crazy because unless you have help in the house, but it really shouldn't be done. And the reason is you're leaving the sugar in the mouth. It's still dripping in the mouth and it's rotting those teeth, and we don't want to do it. Pacifiers, we've gone back and forth in my career. Good, no good, good, no good. Well, the thing up to date today is pacifiers should be used. Whenever you give a child a pacifier or those fingers or thumb in the mouth, what this is doing, it is stress relieving. This is how an infant comforts themselves, just by oral satisfaction. This is what they love. And we know everything goes in the mouth up to 4 or 5 years old. There's still stuff in the mouth, but it's part of that sensor order motor. Like, it does really relieve that stress. So some children are going to have teeth early, but some children, maybe like my grandchild, my children, none of them had teeth at 12 months old, but at 15 months, 6 popped out at the same time. There's other children that 7, 8 months, they're having 2 or 3 teeth. All of it's normal. That's absolutely normal. They say, the formula is how old the child is minus 6 should be the teeth. So 8 months old minus that number 6, they should have 2 teeth. If they don't, it doesn't mean they're behind, because usually you can see the little, hardness in their gums. Infants should sleep quite a bit. Again, it's always back to sleep. Is now said because of SIDS death. They have decreased the amount of them due to just having them sleeping on their back. They should be able to sleep all night long. Not every infant does, but they should sleep 9 to 11 hours at night. And infants who are sleeping should be allowed to sleep. There are very few occasions where we'll say, wake the child up and feed them. And usually those are your premature or your failure to thrive or underweight children. Breastfed infants absolutely wake up more frequently than the formula-fed babies. Breastfed babies might even want it every 2 to 3 hours, and that's normal. You sometimes with formula, it can go every 3 to 4 hours initially, and that's okay too. They're saying that walkers, swings, and playpens are not necessary, but many of us use them. If you want to get things done, you want your infant next to you, you can watch them. You might put them in a swing because you think that movement is good for them, or in that playpen next to you. You can, but it's really not necessary. As I said, we have a lot of immunizations that we do give these children. And here's your list of all of them that you might see. Hep B is your first one we give, and we give that at birth or at the first doctor's office. Why would it not be given in a hospital? You know, sometimes it's the hospital policy, sometimes it's insurance, but usually we'll give them at birth. And again, we load them up. Remember with immunizations, just like adults, that an immunosuppressed child should not get a live vaccine. And that could be that immunosuppressed child, sickle cell disease, or it could be cystic fibrosis, any of those immune things that you might see at birth. They shouldn't get live vaccines. Also, what about those children like toddlers that have croup, you know, that breathing issues, they're on steroids. You can't give them that either. Remember, steroids renders you immunosuppressed. And remember that in the adult world too, it's the same thing. Some special health problems, colic. Colic is such a hard thing for parents. It usually disappears within the first couple months of life, but this child doesn't sleep. This child is crying and they're always in pain. A lot of it's due to gas, and it creates a lot of sleepless nights for these parents, and it's a hard thing to deal with. They're given, you know, stuff to relieve gas. They're giving, you know, ranitidines and all sorts of GI stuff to help them, but it's very difficult. Just, you know, have these parents know that it's going to stop eventually. Failure to thrive is when this kid isn't growing the way it should. For instance, you have a kid born at 6 pounds, and at 6 months old, they only weigh 9 pounds. They should be 12, right? Something's going on. They're not getting the nutrition they need. And you're probably going to see that in growth and development and their cognition. They're not going to be where they should be. So it needs to be investigated. They're going to look at the neuro point of it. They're going to be looking at their GI, finding out why they're not gaining weight the way they should. Because what's the most important thing we can do for our children? Nutrition, nutrition, nutrition. Other things that can happen is children today are on their back, right? Back to sleep. They can have flat heads. You can have premature children that only have been on their sides and they have flat heads. And you're like, well, how do I fix it? Well, we can put a helmet on like this one down here, the bottom right. Or it's also said that if during a wake time and you do that tummy time that you do, having them on their bellies and they can have their head up and looking a little bit, that can help with the head shaping. And infants' heads are so soft and malleable that they will reshape themselves. And you're not going to have that one-sided flat head. Another thing is that diaper rash, right? Diaper rash could be due to the foods mom's eating in the breast milk. Could affect the diaper rash and create it. It could be the type of diaper you used. I have found that my children didn't like Huggies. They liked Pampers. So knowing those things, how do we treat it? Well, if it's yeast, you put nystatin, or you're just cleaning it with soap and water, cool water, and keeping the area clean, changing the diaper frequently, you know, maybe leaving it open to the air and let the air get in there. Cradle cap, that crusty head on the baby, and it drives you nuts because you just want that beautiful hair and to comb it, and it's full of this crusty. So how do you get rid of it? Well, you're going to bathe the child normally. You're going to use soap and water. You might put mineral oil to soften it, but a fine tooth comb or a fine brush gently, because remember, there's that soft spot right there. So you need to be careful with it, and we can help it go away. Sudden infant death syndrome, SIDS. You know, what are the risk factors? Well, there's a difference in genders. Males are more than females. What if this child is in a house where somebody's smoking? Secondhand smoke is a big thing. And also with SIDS, what if that child had just been sick with a little stuffy nose? A frequent viral infection can also cause SIDS deaths. You know, co-sleeping with parents. Those are things that can cause an infant to have a SIDS moment. Now, there's something called an apparent life-threatening event, or an ALT is what we call them. Many times it's they reflux and they get in the back of their throat, they gag, they hold their breath, and they turn blue. And these parents are like, oh my goodness, you know, and run to the ER, and my baby turned blue, and they're going to be admitted, absolutely, for sure. They're going to be examined. They're going to do a GI. Again, they're going to do a neuro test, see what's going on. And once they determine what went on, they'll be sent home with an apnea monitor. This apnea monitor is just a Velcro strap that has 2 leads on it, and it goes to this little box, and you set the alarms for respirations and for heart rate. And when those numbers go lower than what they should be, there is this ear piercing sound that hopefully will wake up the infant and wake up the parent to make sure they shake them to wake them up. So Latasha is a breastfed infant being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Latasha recently began to suck her thumb. Which of the following is the best nursing intervention? Well, at 6 months, should they be sucking their thumb? What do we know about oral satisfaction in infants and children? What do you think?
C.
It is absolutely normal. How do infants self-soothe? They self-soothe by oral, and oral could be a thumb or it could be a pacifier. So it's absolutely normal. So we're going to go into some theorists, and I do have extra questions that I inserted this semester in the Kahoots because I've found that many students weren't getting these theorists the way that they should. The most important of all the theorists is Erickson and Piaget. Those are your 2, and then you're going to see a Kohlberg. So understanding what they talk about, and I did give you a handout. So Erickson talks about trust versus mistrust. So what can an infant trust? Well, if an infant is hungry, wet, or tired, or wants their caregiver, if they cry, somebody goes and gets them, feeds them, changes them, burps them, and holds them. And that they can trust in that when they cry, that's going to happen. Well, what about that infant who cries, and nobody ever gets them? So actually they end up stop crying because nobody's coming. So why should I cry, right? Well, mistrust is none of their needs are met. They're not happy children. They're irritable children because their needs are not there. The happy child is going to be one that all their needs are met. So they have their trust, a sense of trust. Piaget, it talks about using of reflexes, being able to take things, you know, cognition, making things work, that sensor, odor, motor, thing in the mouth, moving around, what it feels like, tastes like, you know. It also talks about imitating what other people do. I mean, you could take a little, almost a brand new infant, stick your tongue out and stick it back and forth in front of an infant. You're going to see that infant try to stick their tongue out at you, and they do imitate it. And it's very young infants you can do that with. Play, you'll always see play. Play is the biggest growth and development we do for our children. Playing with them is what it should be all about. Body images, they're starting to have little mirrors in their cribs and mirrors on the backs of doors and in your bedrooms, etc. And they like to go up to it and they like to look at themselves. And many times you'll lay them on their bellies and look at themselves when they're doing tummy time, and they're starting to learn who they are. Of course, object permanence, we've talked about last week. Even though the toy's not in front of them, they know the toy's still here somewhere. Here's the rattle, you put it, let's say, under a blanket, that infant will go for it. They still know it's there somewhere, even if it's not in sight. You know, and they're also, if you ever see them look at themselves, they don't realize they are, and they'll start whacking on the mirror and getting up there and starting licking the mirror. And I love that when they start being aware of themselves. There's attachment. They love, of course, parents and certain people. Separation anxiety. The first day you drop a kid off of daycare, they're going to be going into separation anxiety. Where is my caregiver? I know I don't have trust for this person, and they have an issue until that caregiver gives them what that trust is all about, that they're fed, that they're changed, that they're held, that they're burped. And stranger fear is children don't like to go to people they don't know and don't know their voices of. You know, you could have a long lost relative come and visit your new baby, and they're 6 or 7 months old, and they want to pick them up and hug them and love them and kiss them all over. And that infant ain't going to have anything to do with it because they're going to be afraid of you. And most of them will turn around and reach for mom and no, I want you. But as they get a little older now, they know that if they're with your mom, your dad, your caregiver, they're going to start peeking around to look at you like, who is that person here? Their language development starts with crying and cooing. Those are the first two things. We know play is so important. And their temperament, you know, what's their behaviors? And there's different ways of measuring it. And that's why I just put this here. And there are questionnaires of different sort of children that we would do a questionnaire to determine, you know, what do they need? So the toddler, my dive bomb kids, I love toddlers. Terrible twos, ages 1 to 3, 12 months to 36 months. This is when they're getting into everything. This is that intense period of environmental exploration. I love what Jerry Seinfeld says. Having a 2-year-old is like having a blender without a lid, because you turn them on and they're everywhere. And you close your eyes for a second and they're from this room to that room into something they shouldn't be into. They want something, temper tantrum, throwing themselves on the floor, but it's also me, I, no. That's what toddlers are. So their weight and their height is slowing down now. They don't need to gain weight and get tall as quickly as an infants do because they're doing all right. So do you need to know all of the numbers of the weight gains in the birth? No, you just need to know it's slower, okay? Again, it's the same thing. They get a little pudgier, then they get taller. They get pudgier and taller, and they're eating hardly anything. We call it like a type of anorexia because they don't eat much, and parents flip out with these children here. But we know that these infants and children and toddlers are getting enough food if their growth and development is where it should be, because we know what those things are because we're learning about them. And at age 2, the child's about half of the adult weight. As we get to this stage, everything, the body systems, just like the heart rate and the respiratory rate, they're going to start decreasing because they're more mature systems going on. Now, one of the things that we see in toddlers is they're always with a runny nose, ear infections, and a cough. It's just part of them. Because remember, everything in the mouth that they love. I call the daycare and these children, they swap spit all the time because that's everything in the mouth on these children. Now, they've got these short, straight eustachian tubes, so mucus can go right into them. They've got these big tonsils and these, you know, big adenoids, and all of that mucus sits there and drips. So that's your upper respiratory. So they do get frequent, these upper respiratory, these viral infections. Children at this point can start to think about controlling their urine and controlling their stools. Their gross and fine motor development, they start to get more coordinated. Not the first year, but the second to third year. I mean, the first year they're learning to walk, then they're waddling, they're falling, you're, you know, behind them in case they're falling. But by 2 to 3, they should be able to move around pretty good. By 12 to 15 months, they can put things hand to hand, not just one side, they can put it both sides. And by 18 months old, they should be able to throw a ball. I know my grandson at about that age picked up a ball, threw it at me, and it missed my head by this much, and it was coming at me pretty hard. And they can throw pretty good. They are getting more visually aware. They can see better, and that depth perception is better. Their eyes are working more together, so we'll see that. So coordination will get better with these children. One of the things that happens with nutrition, is, yes, they're hearing and all that things, and touch becomes more, but their smell and their taste changes. Have you ever tasted what formula tastes like? Have you ever tasted what baby food and the cereals taste like? They're really not good. Infants don't know that it's not good, but it's got all the stuff they need in it. Toddlers, like, they don't like it anymore, and they won't eat it if they don't want to. So they become pickier eaters. They only want, by the age 3, some of them, macaroni and cheese and chicken nuggets is the big thing on those kids, at that age, but trying to keep them well-rounded, of course, would be important. But these kids are only going to eat what they want. And they use all their senses to see what's going on in their environment. They love to play with food. They like to get it all over them. And this is part of growing. I know that bath time was always after dinner because I let them play with it as much as they want because it was part of their development. They needed to. So Erickson and Piaget. So Erickson talks about negativism. It is shame versus doubt. Well, shame and doubt, what is that? Well, Erickson says that you should allow a toddler to do things and not do it for him. It's easy to do it for him, but we need to let these young children do it for themselves because if not, they're gonna feel like they're doubting themselves, that they can't do things. So let them do it unless it will hurt themselves. If you want them to dive bomb between a couch and another couch and they can do it and you don't think they'll hurt themselves, let them do it because maybe they'll fall off the edge, but as long as they're not going to really hurt themselves. They're also into ritualization, which means they like a schedule. They like to wake up at a time. They like meals at a time, certain foods, nap time, same schedule. Toddlers are hard to bring on vacation because vacations messes up their schedules completely. And it's hard because they're frustrated. They don't know what's happening. So they don't have any sense of control or comfort there. And then this ego, super ego, it's all me, mine, mine, mine. They have a toy, it's mine, and they don't want to give it up to somebody else. Piaget talks about taking toys, taking situations, and experimenting with them. They are able to manipulate the situation by things that they do. There's another slide up here which is going to show you some more about it. So that's autonomy, shame versus doubt. So they like that they're able to do things, they're encouraged to do things. And the doubt is that they don't want to try something else because you didn't let them do it. So that's all about Erickson. Now, sensory and motor stages of cognitive development in Piaget. Well, the primary circular reactions is they repeat pleasurable actions, sucking, chewing, pacifier. That gives them sense of comfort. Secondary is like they took the rattle and they shook it and they made a coo, and the parent goes, oh, look, they're playing with the toy. They're going to do it again because they got a reaction. And I think this is the most fun, where they're sitting there in their high chair and they're eating, and they take their sippy cup or bottle and throw it on the floor because mom's in the kitchen not paying attention to them. What does mommy do? Mommy comes back, picks up the cup or the bottle, gives it back and say, don't throw that on the floor again. What did the child want? He wanted mommy. What did he get? He got his mommy. They're starting to, at these ages, start to understand that they have something in between their legs, their genitalia. They will be touching themselves. They're watching mommy and daddy go to bathroom and peeing. Daddy's standing, mommy's sitting, starting to get realization that there is genitalia. And that's why they're touching down there. They are, by age 3, know that there's boys and girls, and there's boys things and there's girl things. So their social development, they're able to go with other people. They know there's mom and dad and there's other people that they can go with. They also like to do things that make them feel special, achievements. It could be that, they're 3 years old or 2 years old and, they're starting to ride their bike with their training wheels. And look, and then, daddy and mom come, go, oh, look what he's doing. Or they're able to take their shoes, and maybe, get them, maybe. This is still maybe more of preschoolers, but they're starting to do things they want to please mom and dad. They are able to express themselves more in the verbal language. They, used to be as an infant, mama, dada, more, milk, they can do that. But now they're becoming more words together in the sentence. They want to be independent. They want to feed themselves. Of course, sometimes the spoon is upside down and they're trying, but as long as they're trying, let them do it. They're also playing by themselves, and they're also trying to dress themselves and undress themselves. They're at this point, remember, they're trying to potty train by, they're 3 years old. So they come back from going pee-pee in the potty and they took their shorts and they put them back on. They're backwards, they're inside out, but they want to do it. They're trying to do it. And toddlers actually do have a feeling for other people. I remember the one day that my grandson came up to me. I was having an RA flare and my knee was swollen and I had ice on it. And he came up to me and hugged my knee and he kissed it. And, and he just wanted me to feel better. So they do have feelings at this young age. Play is important. Play, again, it sparks imagination, it's social, it's so many things that are so good about it. Again, make sure that they get those toys that are right for them. They'll play together, they'll imitate, they like to touch different textures, they like all that stuff. There'll be toilet training, like I said. I mean, I love this little boy facing backwards. I didn't know that when I had my son, but when my grandson stayed here for his first 3 years of his life, I faced him backwards. And, I didn't have wet floors from the, the boy peeing all over the floor because it went over the toilet seat. So putting them backwards was really a good thing. And it does work. And they can touch it and make it go up and down and make fun, designs with the urine. So it was a great thing. And it did actually help in potty training. We know siblings are always jealous, especially if they're older and get a new one. Make sure they're involved in the care so they won't be as jealous. I know if I'm hugging Pop, my grandson's going to come up and say, but you don't love me. I'm like, okay. And this is just a 5-year-old, but he's been doing that forever. He always wants to be that number one person. Temper tantrums, oh yes, this is toddlers. They can go from being nice to temper tantrum, like rapid mood swings, absolutely. And putting them to bed can be horrible. They don't want to go to bed. They want you to lay down. They want to watch a movie. They want to drink a water. They want to go to bathroom. They want. So bedtime can always be a problem with children. I told you, no, me do, mine. That's just part of them. And children, any age child can regress during periods of stress. It could be due to them losing a cat or grandma moved away or any of those life events. They will regress and they'll start having, accidents when they're potty trained, or, they will start sucking their thumb when they haven't done that in a while. So here's some more things for you to go for. I mean, we know throwing the balls at 18 months. I mean, that's my grandson. He almost walloped me in the head. Social development, so important. Kids getting together with other children, seeing what other kids are doing. So 1-year-old, we know it's a 1-word sentence. 2 years old, multi-words. And we know that they're going to try to feed and play and dress and undress themselves. Now, car seats. Car seats should be in infants up to age of 2, rear facing, in the back seat. I remember that silver box there. I remember my brother being in that many, many years ago. So How do you know when car seat is good or bad? Well, car seats do have these date stamped of expiration on them, or date that they were made. And there is this Scrocco baby is one of them that can show you when they expire, but it's usually 6 to 10 years from the date of it being produced that is expired. It should not be used. It is not safe for an infant or a child. And at age 2, I mean, I had a hard time because my little grandson was only 24 pounds at age 2. He's a peanut. He's always been a little kid. Not that he was nutritionally behind. He was just a little kid, still is. So at 2 years old, did we put him front facing in the rear seat? Well, the answer was, and we checked it out, yes. So at 2 years old, it's their muscle, the strength of their muscles that they're able to support themselves in case of accidents. So if they are 2 years old, you can face them front facing in the rear seat. And there's all sorts of resources for teaching parents about this. So the preschooler, ages 3 to 5. This is when they start getting ready to go to kindergarten. Well, I think that initially we put them in preschool, and preschool is a time where children are now put into a situation where they have to sit and they have to pay attention to somebody else, not a mom or a dad. They have to be around other children and they have to get along with the other children. So this is the most significant change that these young children go through, is being that separated and go into that preschool. Their weight, their height stabilizes. It's still slow. They continue to get more mature, their body systems. Preschoolers can tolerate changes in routines and schedules a lot better than the toddlers. Toddlers like rituals. Preschoolers can deal without. Gross motor, walking, running, climbing, and jumping. They can do these things well. Fine motor, they've got good that eye-hand coordination. They can reach out, depth perception. They're starting to color. As they get older in the preschool, they can color in lines with the colors, and they can dress themselves. Again, it may be inside out, it may be backwards, but they will dress themselves. Erickson with preschoolers, what it says. Well, it says that they have feelings. It's developing a sense of initiative, which means they want to do right. They know right and wrong. They know that if they do wrong, they shouldn't. They know that somewhere how. It's either, you call it the super ego or their conscience. It's, yeah, okay, I shouldn't have done that. So they will be guilty. They'll feel that and they'll be afraid because they did something they shouldn't have, but they're also afraid to do something wrong. They acted something wrong. So this, as a preschooler, they're getting more of a conscious. They want to do the right thing. And, if they don't do things the way they should, they're going to feel bad about it. They're getting ready for school, as I said. How do we get a child ready to go into kindergarten? Well, number one, it's the parents' attitudes towards learning, telling them how great school is and what they're learning and being involved. Reading to a child every day is important. My little grandson is very lucky. His mother is a reader and he gets 3 or 4 books a day. And I don't know how she has time to do it, but he will read his books. At 2 years old, this kid could tell me planets from the sun to Pluto. He knew that from reading this book over and over again. I don't even know what the planets, the way they go. My grandson, about 2.5, was teaching me because of reading books. So reading is very important. And another thing is children should be placed in activities with other children, whether it's putting them in a play group, whether it's a sports group, gymnastics, whatever, get them involved in something away from school with children, because that teaches them how to get along with other kids. So cognitive development we're talking about that pre-operational phase. We're talking Piaget. So it's shifting from egocentric, which means me, 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 me. Now I'm being aware of other people's feelings too. It's not all about me. I've got to think about them. And they're starting to think about what they said, and their opinions now are starting to matter. The language, they're talking more and more and more. They're expressing themselves very well now. Their language is getting clearer. Their concept of causality develops. They know if they do something wrong, something's going to happen. Or they do something right, there's going to be a good consequence to that. They do not understand time as in the clock. They don't understand at 2 o'clock, we're going to go to Nana's house. But what they do understand, after lunch, we're going to Nana's house. Or when the sun comes up tomorrow morning, you're going to go on a car ride. They don't understand the clock. They understand events connected to those times. And these children are magical. Ever see a little kid sit there with a toy, talking to themselves, all by themselves or with another kid, and they're talking all this stuff when the car's moving and they're just in their own little world. It's like the magical time. Kohlberg is all about right and wrong and a consequence for each. There is a consequence for being right, okay? They're going to get praise, and many children need that. Wrong, if they do something wrong, there's going to be a consequence for that, whether it is a punishment or timeout or something taken away. They do understand right and wrong and the consequences. They are starting to form a connection to opposite sex. Girls like their daddies and boys like their mommies or grandma and grandpa, whatever it is. They're starting to tell you they don't want you to watch them go pee-pee in the potty. They don't want you to watch them get dressed. They're starting to get modest. They are, dressing up like mommy or daddy, with a baseball hat or, daddy's type of underwears. Or my little daughter was walking around with high heel shoes and you hear the clack, clack, clack coming down the hall. So she was in your shoes again. That's just part of what they do. Again, they're still into exploring their genitals and sexual exploration, and they're going to start having questions. Remember those questions, find out what they know before you answer the questions so you know what they're looking for. This ritualism and this negativism is disappearing, which means they don't need to schedule as much as the toddler does. And they're not into no, 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 no anymore. And they're not into me, me, me anymore like the toddler. They can start to dress by themselves. It may not be done right, but they can dress themselves and they love to please. They know their parents, they know their family, and they know what's expected of them, their standards, their values, and their culture. And they're starting now to question you. I was supposed to have 2 more minutes before I could go to bedtime. Or you didn't do that, so why do I have to? They're challenging that code of conduct. Again, the different sort of plays. Associative, it could be 2, 3 kids together, but there's no who wins. There's not any structure to it. Imitative, it's what another kid's doing. Imaginative could be by themselves and they have their own little playmates. And then we have dramatic or together. They start being afraid of the dark. My grandson never was like that. All of a sudden he came here and he was, didn't like the dark. And I'm like, well, turn on a light. He says, well, there's ghosts in there. I'm like, well, if you see a ghost, send them out. I want to say hello to them. If they're here, I want to know who they are too. But it took a while. And he still is part of it. Large dogs, they don't like that. They feel that they're going to hurt them. They're afraid that their body parts, their genitalia is going to be hurt. And then they're also afraid of people associated with pain. So who is that? Nurses, doctors, right? Those are 2 people that gives them shots. And those people that they can be afraid of. So sexual education, as I said, be aware to ask them first. Use correct anatomical words. So penis and a vagina. Be honest with them. Let them know. Answer their questions. And they will still, a little bit more apparent, have these moments of masturbation. If we see that happening with a group of people, say, could you go in the room, do that by yourself? That's a private time. Go by yourself in the room. It is not a wrong thing. They need to explore themselves, but it should be private. And are you ready for your Kahoots? A lot of good stuff, huh? How are you going to remember all that? Well, I think the Kahoots will help you, all right? You're going to see things, some repeated, because these concepts you're going to see again and again. So let's go to the Kahoots. Seven, 4, 3, 6, 6, 5.
What was it again?
7, 4, 3, 6, 6, 5. So this week you have your first quiz. I've gone over most of it. If I were you, I would go back and revisit your Erickson, Piaget, Kohlberg, because those questions are there before you take the quiz. But we've gone over everything within that today. We've got a good understanding, all right? I wouldn't do a quiz until you come to class. So none of you did, so that's a good thing. All right, let's get started. Week 2, infant, toddler, preschool. What factor predisposes toddlers to frequent infections, i.e. otitis media, tonsillitis, and upper respiratory infections? I think the biggest thing is swapping spit and everything in the mouth, and then, hugging and licking other children. And what makes it so much that they get these infections is they got these short, straight ear throat structures. You've got short eustachian tubes. You've got these adenoids, these tonsils, and the mucus sits there and drips. And this is all part of it. It's not about defense mechanisms, less efficient, because your immune system is actually getting better as we are getting these things. What type of play is considered cooperative play? So we have associative play, which they really have not made any rules or winning, but cooperative play is when you get together, you have rules, and you have somebody who wins. And board games are an extremely good concept with that. Please make sure that you review these plays. I'm trying to give these in the Kahoots for you to understand. So associative, there's no outcome, no winning person. They just play as they go. But cooperative is more of an organized game with an outcome and a winner. I have to stop for a second and say the word billups. My grandson's first word he spelled at 3 years old was blippy. And when I first saw the word billups, it just brought me back to him writing in chalk on the floor outside blippy. I just had to share that with you. According to Kohlberg's pre-conventional level of moral development, a preschooler has moral reasoning what? What does Kohlberg talk about? There's all those other words with it. Yes, it's about morality, but what is Kohlberg? What does he say? I think of all the theorists, this one's the easiest. There's right and there's wrong, and there's a consequence for each. That's it. That's Kohlberg. Which nursing action is appropriate to teach a preschool-age child about a scheduled procedure? Child needs to go in and have tubes put in their ears, and they go in for teaching. How would you do that to be most effective and to decrease all that stress that kid's going to have? Because they're going to. Children want to know what's coming next. And we're going to use a doll to explain. So let me tell you one thing about any child. Number one, don't go in and immediately start touching and feeling the kid. You're going to go in and relax and just get them used to you there. Then you're going to say, you know, something to break the ice. Preschool kid, oh, did you start school yet? Or are you riding a bike? Or oh, I see you've got these really cool sneakers. Start something, you know, and then we can let them touch equipment. They can play with equipment, you know, or play with a doll, show them on a doll. Very important thing. You can't go in and just touch a kid. They're not going to let you. It's not going to happen. And just talking about it won't happen either. Multi-select. What are some findings from a pediatric physical assessment? Well, remember there's a history and a physical. I'm just asking about findings from a physical assessment. So one thing I can tell you as you're doing your tests and your HESI, read the question, because sometimes it's one word. So when we talk physical, it's about growth, and then the review of the body systems. I can listen to the chest, I can look at the ears, whatever. Review of symptoms is what they're telling me. It's more of a history. Okay, that's nothing to do with physical. And family history, again, history. I wanted physical. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? And again, use play with these kids, let them touch these equipment, you know, and so the equipment's not right. And that's after you get on their developmental level, open the ice, talk about something, you know, and this child then it's going to allow you to do a lot more things. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable? What do you think that is? Fists are clenched. You can't console this child. It's all about pain. That is a clear-cut look at pain. Another thing with infants is, how do you know where they hurt? You know, sometimes, let's say it's an ear infection, they could be shaking their head, trying to pain to get away. Or if it's a foot might be moving. So the child can give you clues to location of the pain by these movements too. A multi-select. Erickson describes infants as trust versus mistrust. What does trust mean? I mean, you look at infants, what do they want? What is their life? What is that all about? They want to eat, they want to be changed, they want to be held, you know, and that's trust when they get all those things met. And if you do that, They're going to feel secure. They're going to be calmer. They're going to be happier because they can predict what's coming. All their needs are going to be met. You know, you do not have to have an infant cry a long time to get someone's attention. That is mistrust. A 3-year-old is having an outpatient procedure. How would you help the child to be less fearful? So you can explain all you want, but if you do it, show them a doll, show them the equipment, they're going to be happier with you because they can see that this stuff is not going to hurt them. And they know what's coming. When they know what's coming, they're happier. You need to do an assessment on an infant, and you walk into the room and the infant is asleep in the mother's arms. What do? You need to do an assessment. So if an infant is asleep, they're not cooing, they're not moving, they're not tickled by a stethoscope. You can hear their respiratory status and listen to their heart sounds so much better. So if they're asleep, I'm going to listen right to their lungs and to their heart. That's what I'm going to do. Not put them down, the child will wake up, then I can't hear it that well. When do you switch formula to whole milk? And we put them to whole milk because they need the extra fat for growth. And it's 12 months old. 6 months, we're just introducing food. It's, we're still going to give them iron fortified formula and breast milk. At 1 year old, we'll introduce them to whole milk. A multi-select. When and how do you introduce solid foods to infants? So we're going to start introducing solid foods at 6 months. We are going to do it one at a time, and we're going to wait 4 to 7 days before adding another food. You're never going to put 2 foods together. So 1 food at a time, not together. Before assessing a 4-year-old child, what techniques would you use to approach this child? So you're going to go in and you say, oh, you got a Batman shirt. I love Batman. Or, oh, those sneakers, they're cute, man. They got lights. They got pink lights. I want a pair like you. Or you've got big eyes, or your hair is pretty, or something. And that just breaks the ice. Or even a 4-year-old, you can say, do you ride a bike? Or are you in school? Something. It'll break the ice and you're going to be less threatening to that child. What technique can you be used to examine a toddler? Toddlers ages 1 to 3. And again, use play. Where are your ears? And they put their fingers up, say, oh, let me look in there, and then make a game out of it. Oh, I can see to the other side. Just do things, play with them, use the body parts, and you'll be able to do a complete assessment on a toddler. When assessing a healthy child's lymph nodes, what would you expect? So a normal, healthy child, you should not be able to feel any lymph nodes. When they are sick, you're going to see them, be able to feel these lymph nodes. So a normal child should feel nothing. Which Erickson stage of developmental levels would be used for a toddler? Remember, toddlers want to be able to explore, and it should be encouraged. I mean, sometimes it's easier for us to do it for them, but it's really not the best ideal for the toddler. So it is called autonomy versus shame and doubt. They should be able to do it for themselves and encourage unless it's something that can hurt them. What pain scale would you use on a 3-year-old child? 3-year-old child is a preschooler. So pain scale on a 3-year-old is going to be faces. FLAC is less than 3 years old. That's your infants, toddlers, and nonverbal children. Very important thing. You're going to see this over and over again. Pain scales are very important on your NCLEX, SE, etc. Doesn't mean that a FACES scale can't be used on a younger kid, but according to your book. We'll multi-select. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So you allow the infant to try things by themselves and new things. And also that shame is when that parent doesn't allow that toddler to do it by themselves. It has nothing to do with the concept of Erickson about playing by themselves. When walking into an exam room, you see a 2-year-old rubbing a stuffed animal on their pubic area. What do? We know that, children, toddlers, preschoolers, they do exploration on their genitalia. So what you're going to do is say, Mom, I'll be right back. I forgot something, and then come back. Don't pay attention to it. Bring attention to it because it is a normal thing that children do. A 2-year-old boy is playing with mud and dirt. What type of play is this? Could be sand and building a sand castle, mud, dirt, sand. And it's all about sense and pleasure. It's all that touch and that feel of it. And they like that. So it's touching and playing with the dirt and the mud and the sand, and they like that feeling. A parent of an 18-month-old says that he says no to everything and has rapid mood swings. What do you think this is all about? Absolutely normal. No, 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 me. They could be fine a second, and next second they're on the floor having a temper tantrum. That's toddlers. Remember, blender without a lid on, everywhere. What is descriptive of a preschooler's understanding of time? So preschooler only understands time with events. They don't understand a clock. After lunch, we are doing this. And when the sun comes up tomorrow, this is going to happen. So only time with events. A 4-month-old is crying, shaking their head. What feature of pain is this infant showing? And they're showing there's something in the head's bothering them. They're trying to get rid of that pain. And they're like shaking it away. Sometimes you'll even see them batten their ears if it's pain, with doing with their ears. So that is location of pain. Now, infants can tell you more than you think they can. They'll show you these different things of, the crying, of course, the shaking of the legs, batting of an ear, shaking their head. These are things telling you something's going on. A 1-month-old infant's back of their head is flat. What would you tell the mother? She's upset. What do I do? I mean, the kid's on back to sleep and the head's getting flat. What am I going to do? Is this kid's head going to be flat forever? So put them on tummy time when they're awake and alert. And it does, because their skulls are so soft and malleable, and they will shape back out. Infants crawl before they walk. This pattern of growth and development is called what? They crawl before they walk. They lift their head up before they roll over. They roll over before they crawl. They crawl before they creep. What is that? What pattern of growth is that? What is it called? And it's called sequential trends. Things happen in sequences. Remember, it doesn't matter if you skip a step, as long as they're moving in the forward direction, we're doing good. How do you communicate with parents that do not speak a language that you know? And the best way is to get that telephone interpreter. There's these blue phones. Most hospitals have them, these blue phones. You're on one side and the interpreter's on the other, and then we can get a good translation. You do not want a family member interpreting for you, because they're going to imply their own opinions to what that parent is talking about. Staff members would be nice, but today's staff members are so busy, you may not have time. So the best way to do it is use a telephone interpreter. It's actually very easy to use. What age would most children could understand under, on top of, beside, over, around, and back of? You put your shoes underneath the couch. It's behind the table. It's on top of the desk over there. It's beside the door. And that's about 4 years old when they start being able to do that, okay? In terms of language and cognitive development, a 4-year-old child would be expected to what? Language and cognitive development. Cognitive remembers how they think. And they should be able to follow simple commands. Go put your clothes in the dirty laundry. Let's go to the bathroom. Let's take our bath. Come on, it's time to have dinner. Go wash your hands. These are things a 4-year-old should be able to do. They're not into really understanding another person's perspective. That's way too advanced for this child. And they don't think abstract yet. They need concrete sort of information. They can't figure it out by themselves without that concrete information. How would you assess the pain of a toddler? Ages 1 to 3. So a toddler is on the FLAC scale. So I've given you several questions last week, this week on FLAC and on faces. I hope that has helped you to understand it. A multi-select. What safety instructions would you teach the parents of a 6-month-old child? Remember, 6-month-old children, they're starting to get up on their knees. They're starting to be able to scoochie around a little bit, motion on the floor. Of course, car seats, we're facing for sure, covering those electrical outlets. And remember, this child at 6 months old should be able to turn completely over. So absolutely don't leave them alone. And introducing foods, it's going to be one at a time, 4 to 7 days apart. A multi-select. What are cognitive characteristics of a child 2 to 7 in the pre-operational stage? So remember, they're still thinking I am number one. They can play with other children and they're extremely imaginative. And this is part of it. They're not logical yet. They don't know really how to put things together yet in a logic yet. It's too young for them. A nurse receives a phone call about her 6-week-old baby. He's crying a lot. What can she do? So you've got a mother is upset. She's got a young baby. He's crying every day, a lot. What can that mother do? What's the nurse going to tell this parent? So this child, 6 weeks old, this is in a very tender age. These children have no immune systems and so many things could be going on. That child needs to go to the doctor's office for some more information because this child, it could have other things going on. So we can't just say to burp or change formula. No, needs to come in, needs to be examined to make sure it's maybe something going on with the belly. There's a lot of GI stuff that can occur. A multi-select. What should an infant be able to do at 9 months of age? At 9 months of all of these. So they don't need support to sit at 9 months old. They should be able to sit unsupported. Yes, they're going to hold a rattle. They're going to shake it. They're going to put it hand to hand even. They're going to do a pincer grasp that's almost okay. And they're going to pull themselves up. They're going to creep and they're going to roll over. Yes. The first expected fine motor developmental milestone for an infant begins with what? F, fine fingers, right? Gross, G, go, 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 movement. So the first thing that happens is that reflex palmar grasp. The mother puts that finger in the newborn's baby's hand and they squeeze it, and they're just so happy. My baby just gave me a hug, but it is a reflex. Then it goes into voluntary. A toddler's parents ask the nurse for suggestions on dealing with temper tantrums. So the best way is to ignore the behavior, make no comment as long as they can't hurt themselves, okay? Explaining them or leave them alone until it's over. Well, sort of leave them alone, but more ignore it and walk away from it and don't talk to the child at all. And then the child realizes they're doing something, getting no response, so they stop doing it. A 2-year-old has difficulty in activities, sensory sensitivity, and only speaks one-word responses. How can you assess this? Children at 2 years old should be able to speak in multi-word sentences. They should be able to play with themselves. They like senses. They like, people and things around them. So something's going on here. And this is probably a child that we're considering who has autism. And we can look at that and evaluate them with this checklist for autism toddlers. And it does help. So then we can put in early intervention and help these children be able to deal with the way that they're feeling. Parents are concerned their 8-month-old child is not developing like their older child. What is normal for 8 months? So they should be able to sit alone unsupported. That is an 8-month-old child. Pull themselves to a sitting position, but the big thing that they want to see is that sitting alone unsupported. Because they could pull them up, but they could fall over if they pull themselves up. So unsupported is the answer. What fine motor skill is expected of a 4-year-old child? F, fine fingers. So fine motor, skipping is gross. Walking up the stairs is gross motor. Tying shoelaces is not till ages 5 or 6. They should be able to button a shirt. Doesn't mean it's going to be correct. Maybe the buttons and the holes are wrong, but they can button a shirt. Multi-select. What gross motor skills should a 4-year-old be able to do? So they should be able to walk up the stairs using both feet. And 4 years old is when they start to be able to hop on one foot. They can't tie their shoelaces yet. It's almost 6 years old, and jumping rope the same. Car seats can be safely switched to the forward-facing position at what age? So that is at 2 years old is when you switch them from rear facing in the back seat to forward facing in the back seat at 2, because their muscles are at that point, they're mature enough to be able to handle that. RNs doing a developmental screening on a 10-month-old should expect which fine motor skills? Fine fingers. So they should be able to grasp a rattle, probably put it hand to hand and start with that pincher grasp. They should be able to do it. When you're talking about building a tower of blocks, that's at 1 year old, and putting objects or taking them out of a container objects, that's at 11 months old. So 10 months old is only the handle, grasping that the rattle and using the pincer grasp. Frequent developmental assessments are important for which reason? Why do we need to know all of these things that we're learning about children? Why do we need to know when they're going to button their shirt or hop on a foot or throw a ball or turn over or walk? Why? Because if they are not meeting these developmental milestones, something is going on, and they're going to need early intervention to be able to catch them up. It might be speech therapy, physical therapy, occupational therapy, but something's going to catch them up to where they need to be. I mean, children are so resilient, they catch up pretty quick. Multi-select. An infant searches for her toy that is not in sight. What's that? So we know it's all about object permanence, but it's memory. They realize the toy's there somewhere, they're remembering it. And it's also, this is where an infant starts playing by themselves. They're exploring for it and finding it without any of the caregivers, mom or dad. It doesn't have to be there. They still can find it. The natural physical developmental sequence that most children follow is those sequential trends. So first thing is lifting their head. Then they roll over, creep, crawl, cruise, and walk, and that's all the way it should be. Starts with the head. A multi-select. Which would alert the nurse to hold the digoxin on an infant she's caring for? The way you give digoxin on an infant's the same thing you do for an adult. The only difference is the difference in vital signs that you're working with. So a heart rate of 90 is way too low for an infant. I would hold it for that alone. Digoxin level 3.3 is way too high. The levels are the same, whether on an adult or an infant, same thing. Also potassium. Low potassiums can cause toxicity. Same values are the same for adults that are for infants. And there's no reason with bounding peripheral pulses has anything to do with digoxin. In general, an infant should triple their birth weight about what months of age? And that's at 12 months of age. They double it at 6 months, triple it at a year. When an infant's toes spread when the soles of the feet are stroked, this is called what? Same thing as adults. It's a reflex. And that is Babinski. Same thing. Rooting is when you stroke the little cheek and the baby goes for either the breast or the nipple to eat. Startle is when you make a loud noise or you hit the isolette they're in and their hands come up, their feet come up, they're startled. And the grasping is that whether voluntary or reflex. When entering an infant's room, the door slams shut and the infant jerks and starts to cry. What is this reflex? This is the other name. So it's either startle or moral. Rooting again is eating, and we know Babinski, and it is a normal reflex, but it's called a moral or startle reflex. A 4-year-old is reluctant to take their medicine. What intervention should the nurse take? This is a common thing with kids. They just don't want their meds. You have to go through all sorts of things. And as nurses, our job is to get this child to take the medicine. And what the book tells us to do is to do a straightforward approach. You should not ever mix medicine in food, juice, or milk. What if they don't take all the food, juice, or milk? How much did the child get? You don't know. Unless there's a tiny little bit with the food and they take the whole spoon. It's the only time. But the straightforward approach, what does that mean? Okay, you need a medicine. Do you want to chew a pill or do you want liquid? If you want the liquid, okay, you want it in a cup or do you want it syringe? You can squirt your mouth with it. That's straightforward. And when you don't give them an opportunity to say no, they're more apt to take their medicine. Which intervention helps a hospitalized toddler feel a sense of control? What do we know about sense of control in toddlers? What do they like? They like rituals. They like to know the same things are coming all the time. They eat the same time, they nap the same time, they bathe the same time, and hopefully we'll get the foods the same, if the diet allows. It's a ritual. Toddlers love rituals. And are assessing a 2.5-year-old toddler, what findings should you report to the provider? Which of these is not right? At birth, babies' heads are bigger than their chest. By about 2 years old, you're going to find that the head should be equal to or less than the chest circumference. Again, if it's bigger than the chest, the head's too big. Something's wrong. Is it hydrocephalus? Is it a tumor? What's happening? And it needs investigation. A multi-select. What are risk factors for SIDS? Boys are more than girls, so gender is. Smoke, absolutely. Recent viral infection, yes. Actually, breastfeeding an infant decreased the risk for SIDS. Very good. What does the rooting reflex enable the infant to do? Remember, that's the stroking the cheek. They put their mouth towards breast or to the bottle so they can eat. Very good. A multi-select. A child's been admitted with profuse diarrhea for 2 days. What would you expect? I will, throughout these Kahoots, infuse questions on acid-base balances. There were 4 questions on the last essay regarding this. So I'm going to make sure you understand this. And if you don't, please make an appointment with me. So definitely any loss of fluid is going to be hypokalemia. You're losing potassium. When we're talking about diarrhea, you have a lot of alkaline secretions being released because the enzymes which do the food digestion are alkalinic. So you get rid of the alkaline, you're going to be left with metabolic acidosis. Okay. If you don't understand that, let me know. But with vomiting, you're losing acid. So you'd be metabolic alkalosis because you have stomach acids. You're getting rid of it. So that would be opposite of diarrhea. An infant unable to take breast or bottle feeding. What's important to remember? You know, to see this little infant. It's there, it's got a little tube in its mouth, can't eat. I mean, we need to always promote proper growth and development. What do we need to do for this infant? I mean, how do infants soothe themselves? You need to put in a pacifier, a non-nutritive sucking device. If they are unable to take breast or bottle, sometimes it's due to some physiological condition where you don't want anything in their mouth. So no water, no formula, mouth care. I mean, vigorous? No, you're going to keep the mouth clean, but not vigorous. But that pacifier is their #1 priority. What does an infant start to do at 3 months? So at 3 months old, they should be able to lift their head, but they're starting to roll over, usually front to back. And again, 3 months old, you got to be careful with these children where you place them. And last question, an infant's first form of communication is? And it's the crying and the cooing. That's what you're going to see first. Let's see how we did today. Number 3, TN. Number 2, Tiff. Good job, Tiff. Good job. Number 1, almost the whole way through, Mr. Blippy. Billups. And I don't mean Mr., I mean just Blippy. I think that's great. KL and Jabari, 4 and 5. Good job, guys. Thanks for trying and really putting the effort. If you do that and you put in the effort, you're going to do so much better on exams and HESIs, etc. So good job. Please sign your attendance attestations. You have 3 points of entrance this time. You have a discussion, you have your attendance, and you have the quiz. Again, before your quiz, please look at your theorist before you get there, okay? Thank you, everybody. Have a good night. Anything you need, let me holla. Just let me know. Okay.
Thank you. Bye.
My pleasure.